Hi, I'm Dr. Ann. Thank you for joining me. Today I wanted to first introduce myself and then tell you about one of my favorite mindfulness techniques, EFT, also known as tapping or emotional freedom technique. So first of all, I am an internist. I work as both a hospitalist and I also do integrative primary care and pain management. And I've been using this technique both in the hospital and in my clinic for about the past 5 years. I really adopted this practice, which I had been exposed to years ago. However, I really started to use it after I found myself in one of the most overwhelming experiences of my life with a family member unexpectedly on a vent in the ICU, actually being extubated and basically freaking out because they didn't understand what was happening. And in that moment, it was so hard to witness that without even thinking, I started using this technique and it completely calmed me down. And then my family member, even though they couldn't focus on anything else, started to focus on me and started doing this technique with me. So by the time the ICU nurse had returned with the syringe of Haldol to, counteract their their hysteria, they completely calmed down and didn't need medication for the remainder of their ICU stay. And that really motivated me to go get trained in this technique. And I've been using it, like I said, for myself and my patients ever since. So I'm excited to share it with you because, especially during this pandemic, we need all the tools and especially effective tools possible. And I know that this is one. So just a little brief introduction about it. You can go to my website. Well, you're probably on my website, but medicinewheel.org to get some more information. And also feel free to email me there with any questions or clarifications that you might need. So, emotional freedom technique, what is it? It is a mindfulness technique. It combines the principles of cognitive behavioral therapy with stimulation of the traditional Chinese acupuncture points. There have been hundreds, if not thousands, of studies on EFT over pretty much the past 2 decades. And so we've teased out a mechanism of action. And what happens is this technique allows us to really inhibit the amygdala's fight, flight, or freeze response. In addition to the amygdala's or the amygdala-induced pathways that respond to these traumatic events, emotions, or limiting beliefs. Again, there's a link at my website where you can review many of these studies, but I would just like to mention the things that really stood out to me, and that it really is study after study that has shown that this technique will decrease cortisol levels. In addition, it's been shown to increase some of our feel-good hormones, including oxytocin, serotonin, and GABA. So, how do you do it? It is deceptively simple, which is great, and also sometimes leads us to think, it can't work because it is too simple. But I just ask you to give it a try. So, We use certain, like I mentioned, acupuncture meridians, and I'd like to show you the main ones that we use. They are the top of the head. I like to also include the occiput, the beginning of the eyebrows, side of the eye, on the cheekbone, right underneath our pupils, under our nose, under the bottom lip, all over the chest. The next one is right where our ribs jut out, and I like to make this motion, and it's just rubbing those ribs. The next points are on the side seam of the body, right at your bra line. And for those points, you can either cross your arms or do it like this, whatever way is more comfortable for you. The style of EFT that I like also includes wrist and hand points. Not all practices include that, but I'm going to. So inside of the wrists, you can either do it this way, or I like to do it like this. And now we're going to move to the fingers, and really it's going to be where at the bottom of our nail bed. So we're on this thumb side, bottom of the nail bed, just tapping right there. And then the same spot on the pointer finger, same spot on the middle finger. The ring finger is the only one that's different. It's actually on the pinky side of the ring finger, but still at that base of the nail. And then pinky finger, we go back to the thumb side. And final point is the side of the hand, also sometimes called the karate chop point. So what we do with EFT is we bring into our awareness, and we use our voice to do that, any limiting belief, memory of a traumatic event or emotion, or focus on physical discomfort. We bring that into our awareness by verbalizing it while we are introducing tectonic stimulation or tapping to those meridian points that I just reviewed. And while we're doing that, we take nice deep breaths and release them. And it's helpful if you release them with a little bit of sound. And the breath is a really, really effective way to help our nervous system release some of that stored up stress that we are now bringing up to the surface so that we can release it. So I mentioned that we are using traumatic events or memories. It's easy to start with just an emotion. And so let's start with, for example, anger. So deep breath. And all we're going to do is say the words anger and bring our awareness to any sensation of anger in our body or any memory. And in the sessions, we will be a little more specific. So deep breath, this anger. And what happens as we do this is this really gives our body a chance to access any areas where we have stored that energy of anger in our nervous system. And we're not trying to change anything. We're not trying to tap the anger out of ourselves. It's more that we're kind of reassuring ourselves while we are in some form experiencing anger. We're almost reassuring ourselves that it's okay to feel that anger. So this anger, I acknowledge this anger. And that is telling our amygdala, okay, I'm okay with anger. I don't have to stay in this fight, flight, freeze state in the presence or the remembered awareness of this anger. So as we're doing this, the body will release some of that stored stress, and it will do it in different ways. A common way is by yawning. Sometimes it's burping. Sometimes it is bringing up sputum or phlegm. Sometimes it's getting really sleepy. Sometimes it's a physical sensation that you will actually feel moving in the body. So this is an experiential practice. I now invite you to try one of the 15 to 20 minute videos that I have so that you can experience this yourself. Thank you.